Brought to you by Dr. Joe Ordia. Frequently asked questions about neurosurgery and pain management. Questions 11 to 15. Epidural steroid injection, benefits and limits. I start with a disclaimer. The opinions expressed here are for general information and based on my own professional experience. They are not intended to replace the advice of your healthcare provider on your particular condition.
Question number 11. My friend popped a disc in his back and couldn't walk, and PT was too painful. He got an epidural and 3 days later he said that his back felt much better and the leg pain was gone. When I hurt my back I asked for an epidural. Why did the doctor tell me that trigger point injection would be better for me?
Answer. Not all back injury is the same. It is likely that your friend's injury resulted in a pinched nerve, hence the leg pain. In your case, if you sustained back strain and muscle spasm, then trigger point injection of local anesthetic into the muscles would be more appropriate.
Question number 12. I got a series of 3 epidural steroid injections at the pain clinic 2 years ago and the pain in my right leg went away. Now I am having back pain and it goes into the left leg. My PCP said that I should come back for another injection. I thought that I could only get 3 steroid injections in my lifetime.
Answer. Steroids have potential side effects with frequent or prolonged use, and they include elevation of blood sugar, making it difficult to control diabetes, suppression of immune system, and increased risk of infection, osteoporosis, and risk of fractures, reduction of adrenal gland, hormone production, weight gain, muscle weakness, poor wound healing, erectile dysfunction, and loss of libido. In order to avoid these unwanted effects, the amount of steroid that is administered in epidural injections is monitored and recorded. The number of injections is often limited to not more than about 3 every 6 months. Your thought that it is 3 injections in a lifetime is incorrect.
Question number 13. I was playing football and I threw out my back. I did 4 weeks of PT and the pain is somewhat better, but I still get sharp pain in my left butt and it is very painful to sit for more than 10 minutes. My ortho doctor examined me, looked at x-rays of my spine and she said that the pain is in my SI joint and that I should see you for an injection. Don't you always get an MRI before you give an epidural?
Answer. An epidural injection refers to introduction of medication, usually steroid, to the surface of the nerve. MRI or CT scan is often obtained to determine which nerve roots may be pinched or inflamed and to determine the optimal target for the injection. The sacroiliac SI joint is the joint between the sacrum and the iliac bone, is lined by cartilage and connected by fibrous ligament. The nerve roots send tiny branches to the joint. They are often not seen on CT or MRI. X-ray study alone will suffice if the diagnosis is back strain. However, if there is suspicion for other risk factors such as fracture, infection, or tumor, then more advanced imaging studies may be considered.
Question number 14. I am presently in AAA baseball and my ambition is to make it to the major league. I ruptured a disc in my back and my doctor wants me to get a steroid injection. Won't it make me fail a drug test and ruin my career?
Answer. There are different types of steroids. Corticosteroids have anti-inflammatory properties, are commonly used for joint and spinal injections. Their medical use is legitimate and will not get you in trouble. What you are concerned about are the anabolic steroids. These are structurally similar to the male hormone testosterone and are illegally used by some athletes to build up muscles and enhance performance, better known as doping. Anabolic steroids have serious long-term risks to your health.
Question number 15. My doctor recommended epidural steroid injection because I have a herniated disc which is pinching my nerve and giving me terrible leg pain. Why wouldn't they do an ablation?
Answer: epidural steroid injection is more appropriate for your pinched nerve. Radiofrequency ablation, RFA, also called rhizotomy, is the use of an electric current to heat a portion of a nerve to block the transmission of pain signals. It is commonly used to treat some types of arthritic chronic pain in the spine, knee, and hip. Cardiac specialists also use ablation to block certain areas of the heart from generating and transmitting abnormal heart rhythm, such as atrial fibrillation.